Hi everyone, my name is Saisha and today I'm going to talk about the topic poliomyelitis. Poliomyelitis is also called as polio. It is caused by the virus called as the poliovirus. Now, poliovirus is at the edge of eradication. Also in India, we do not see any cases of polio now. If you want to talk about India, talking about India, the last reported case from India was in West Bengal in the year 2011, and from 2011 we have not seen a single case of polio since. But there are some countries like Pakistan, Afghanistan and Nigeria. Now, in these countries, polio is still prevalent. We still see cases of poliovirus in these three countries. The rest of the countries have totally eradicated polio. Now, in Pakistan, the last known case of polio was in the July of 2021, very recently, and in Afghanistan, the last case was in the February of 2021. So in these countries, the virus is still prevalent. Also in Kenya, Iran, Nigeria, Tajikistan. So these viruses still prevalent. Now let us talk a little about the polio virus. Okay, let us talk a little about the polio virus. Let us talk about its morphology. Now, what I mean by morphology means how does the virus look like? What type of RNA does it have? What family does it belong to? So talking about its family, poliovirus belongs to the family of piconaviridae. Okay, it belongs to the family of piconaviridae. It's a very small virus. First of all, it's a very small virus. It does not have this envelope, so it is a non-enveloped virus, and it contains a RNA. What kind of RNA? A single-stranded positive sense RNA. So it contains a positive sense single-stranded RNA. So this was a little bit about the poliovirus. Now let's talk about the pathogenesis. Now, what do you mean by pathogenesis? Pathogenesis means how does the virus enter into the human body, or how does the human get the infection, how does the human get the virus. So that is called as transmission. So how does the virus enter the human body? Now the virus can enter, one is via the fecal-oral route. Fecal-oral route. Fecal-oral route is somehow the contaminated feces of one infected person is transmitted to a normal human being via ingestion of that. Or it can also be transmitted by inhalation route, that is a infected person is going to sneeze and all the droplets will be there, and a normal person is going to inhale that thing. So that by inhalation. These are the two ways in which a normal person can get infected. The next thing is, now this is a virus which has already entered into the human beings, maybe via the fecal-oral route or via inhalation. Now this one virus which enters, it has to multiply into the human body, right? It has to multiply. From one virus, it has to multiply into many viruses. Now, how does this multiplication occurs? Basically, where does it occur? So it occurs in the tonsils, it occurs in the Peyer's patches. Apart from this, it also occurs in the intestinal epithelial cells, the submucosal lymphoid tissues. Okay, so it multiplies over here. So one virus, it multiplies into many, and once the virus has multiplied, now it has to spread into the human body. Right? It is now present in the tonsils, it is present in the Peyer's patches. From there, it has to spread throughout the body. And how does this occur? It occurs via the blood. Now, it spreads via the blood, right? It spreads via the blood, and this spread via the blood is called as the hematogenous spread. When it spreads by the blood, it's called as the hematogenous spread. So it spreads all over the body. It also enters into the lymph nodes, and it multiplies over there, and once it has multiplied, it is also going to release them into the blood, right? So one way how the virus spreads into the body is via the blood, The second way how the virus is going to spread is via the nerves, and then it spreads via the nerves. It is called as the neuronal spread. So this you can is the nerve. This is the nerve, and it is called as the neural spread. So it spreads via the nerves, and one of the most common nerve which helps in the transmission is the glossopharyngeal nerve. Glossopharyngeal nerve. Now, what is this glossopharyngeal nerve? Glossopharyngeal nerve is a nerve which supplies the parotid gland, supplies the tongue, the pharynx, the body. So, because this nerve is affected in this virus, what you get is you get dysphagia and you get dyspnea. What is dysphagia and dyspnea? Dysphagia means there's difficulty in swallowing the food or difficulty in swallowing anything. Secondly is dyspnea. Dyspnea is difficulty in breathing. So since this nerve, which is having sensory and motor supply to this functions, to the pharynx, to the tongue, you will have difficulty in swallowing, you will have difficulty in breathing as well, or there will be shortness of breath that you will face. Now, once this is done, where does the virus ultimately spread to? Where does it ultimately go to, and what does it affect? So finally, this virus spreads to the spinal cord and to the brain. Spinal cord and the brain. And that is why in this disease, what is the most important thing that happens in this disease is muscle weakness. Because the spinal cord is affected, you will get muscle weakness and flaccid paralysis. Flaccid paralysis will be decrease in the muscle tone. There will be muscle weakness. Okay, so these are the two places which are affected: spinal cord and the brain. Now, the most important thing that we come to now is clinically what actually happens to the patient who acquires this polio virus. Now, first, incubation period. The incubation period of this virus is 7 to 14 days. That it takes 7 to 14 days after the virus has entered the body, then it will start showing the symptoms. It takes that much time to replicate inside the body, multiply inside the body, and spread. Now, once it is inside the body, this virus undergoes 4 stages. It has 4 stages. Let's come to the first stage. The first stage is called as the inapparent stage. Inapparent stage, basically what does inapparent mean? Inapparent means showing no signs. Now this happens in 96% of the people who are infected with this polio virus. In 96% of these people, they will be asymptomatic. They will show no symptoms at all that they have the polio virus, the inapparent stage. The second is the abortive stage. Now, abortive stage means you'll start getting very minor symptoms like headache, fever, vomiting. So these symptoms will not tell you that you have the polio virus. These are very minor symptoms: headache, polio virus, which you even get it during common cold when you have cold, right? So they will not indicate that you have the polio virus. So very minor symptoms. In the third stage, it's called as the non-paralytic stage, meaning there is no paralysis in this stage, but what does the patient have? He suffers something called as the aseptic meningitis. What is meningitis? Meningitis is the inflammation of the brain or the inflammation of the meninges of the brain, right? But aseptic means there is no bacterial infection of the brain. There is inflammation of the brain, but it is not bacterial. That is aseptic meningitis. The last thing that happens here is the fourth stage is your paralytic stage. The paralytic stage. Now, this is an important stage, but it is the least common stage, and it occurs in less than 1% of the people who are affected with this virus. In less than 1% of those people, you will see the paralytic stage. Basically, what happens over here is you will see flaccid paralysis. You will see paralysis in this patient, right? And this paralysis, it starts from the waist. The paralysis starts from the waist, and then it spreads to your extremities, to your legs. It spreads to your extremities, and a very prominent sign will be a tripod sign, which is seen in this disease, a tripod like sign, right? Next, another important thing in this disease is your course, the course of this disease. So in this course, which is seen in the children, what happens is your first, the child is going to present with aseptic meningitis, aseptic meningitis. After that, the patient is going to show some recovery, that is, there will be recovery of a few joints. The joints will start to recover, he is going to get his mobility back, he is going to feel all right, but then again the fever is going to return. So there is a return of the fever is going to return, plus paralysis. So the fever will return along with the paralysis. Now, I just said that this paralysis which occurs, it is in less than 1% of the population. It is very uncommon to get this paralysis. So who are the people who are at risk of developing paralysis? So the people who are at risk of developing this paralysis are the adults or the older children who get this virus. Second, the pregnant woman. Third, those who have just done a very heavy exercise in them. And last, who have just recently gotten an intramuscular injection. So in these people, they have really high risk of getting this paralysis after being infected with the polio virus. Lastly, we come to the complications of this virus. Complications. Now, what are the complications? First of all, you can have some respiratory complications. Meaning you can have some obstructive complications. As I just told you, you can have difficulty in breathing, you can have difficulty in swallowing, there will be shortness of breath. So those are your respiratory complications. Secondly, you can have urinary complication, that is, there will be urinary retention. Right. Another thing, very important thing, is 20 to 40 years after you have been infected with this virus, after 20 to 40 years, you will see some new muscle weaknesses. So the muscles which have already been infected, they are already infected, but your new muscles which were not previously affected, they are going to show muscle weaknesses after 20 to 40 years. And the next thing is, I just want to tell you about the vaccines. So the vaccine, so we have two types of vaccines. One is the oral polio vaccine and one is the injectable polio vaccine. And the oral polio vaccine, the dose 0 which is there, it is given right at birth. And there are another 3 doses, the dose 1, 2, 3. The dose 1 is given at 6th week of age. The second dose is given at the 10th week, and the third dose is given at the 14th week of age, right? So you have total 4 doses of the oral polio vaccine. The injectable polio vaccine which is there, you have only 2 doses which are given. The one is given at the 6th week and another one is given at the 14th week of life, along with the oral polio vaccine. These two are given together, as you can see, 6th week and the 14th week. And in oral polio vaccine, you also receive a booster dose which is given at 16 to 24 months. So it is given over here, that is a booster dose of the oral polio vaccine. Just an overview of what we have done already. The poliomyelitis, also called as the polio, it is caused by the virus called as the poliovirus. It is almost at the edge of eradication, except in a few countries where it is still prevalent. The poliovirus belongs to the family piconaviridae. It is a small non-envelope and a positive sense single-stranded RNA. How does it enter the body? Via the fecal-oral route and also by inhalation. When the person inhales it, then it enters the body and it multiplies inside the body in the tonsils and in the Peyer's patches, and then it has to spread throughout the body, and that it does via the blood. It also spreads via the nerves, and one of the most important nerve is the glossopharyngeal nerve. And since this is infected, we have the difficulty in swallowing, we face difficulty in breathing and shortness of breath. The two important places where it is affected is the spinal cord and the brain, and we see there is muscle weakness and flaccid paralysis. Clinically, we see there are 4 stages in this disease. The first stage will be asymptomatic, then the person will start developing some minor symptoms like headache, fever, vomiting. After that, they will start getting aseptic meningitis, that is inflammation of the brain. In this, you can face all the symptoms that you see in meningitis, that is fever, vomiting, neck rigidity. Your neck will become kind of stiff and rigid. And the fourth stage is your paralytical stage, which is least common. Only less than 1% of the population face, 1% of the patient face this, where you get paralysis, flaccid paralysis, which starts from the waist and it spreads to your extremities. Secondly, the cause you will, and which people are more prone to get this paralysis are your very heavy exercise, who have recently gotten intramuscular injection. Intramuscular is injection in the muscle, and you have complications. You can have some respiratory complications, there can be urinary retention, and the last thing is after 20 to 40 years, again new muscles can start getting infected. The new muscles can start developing weakness. There are 2 types of vaccines which are available. One is the oral polio vaccine, which is taken orally, and the injectable polio vaccine, which is injected. In the oral polio vaccine, you have 4 doses a week and a booster dose. In the injectable polio vaccine, you have only 2 doses. That's it about poliomyelitis. Thank you for watching.